Hi, this is Dr. Tieche from Recharge Clinic, and I wanted to talk about something that's starting to rear its ugly head again in the news. And this is the new COVID variant. And I want people to just be aware of it. I feel like the news media, as it has always done, tries to ramp up people's fears and get people nervous again. And although right now there's not any really great specific treatment for it, I think some of the protocols that have been used by these national COVID fighters will still carry true, because this virus is of the same strain as the original two, the original COVID and the Delta variant. And I believe that it will respond to those treatments. So why am I bringing this up? Is because I think one of the things that we know more than anything in treating COVID, and myself included, is early treatment is key. Early treatment is key. And in fact, it is extremely treatable. I don't think that we have to have in our mindset that COVID is a death sentence and that people die. Yes, many people did in the previous things, but I think one of the things that we've learned from the original and the Delta 8 variant is that we have to treat it early. And the people that get treated early respond very quickly and very well. And then they have much less lingering on symptoms. And that's the big thing that we see with people who have had delayed treatment. Their symptoms, fatigue, maybe even neurologic symptoms, go on for a long time. So I think really at the beginning of your symptoms, you should seek treatment anywhere that's providing current medical treatment. Do not have someone just tell you to go home and stay and rest in bed. That is not a treatment. Although, and for other illnesses, maybe the common cold, that would work. COVID, absolutely not. We want to be super aggressive, and we have formulas of medications that we know that have been tried on hundreds of thousands, maybe even millions of people, and we know that they work. And this holds true for both the vaccinated and the unvaccinated. There is an incredible number of breakthrough infections for the vaccinated. And so we basically, in my mind and in my clinic, just want to know that really we are treating everyone, and our clinic is available and open to treating these people, and I don't want anyone to feel like they're isolated and can't get treated. There has been a little bit of prejudice towards unvaccinated people. We do not care if you're vaccinated, unvaccinated, black, white, green, yellow. We don't care any of those things. We want to help you feel better and getting you feeling better as quickly as possible. So at the earliest signs of any kind of problems, please come in and get help. Frequently asked, how do we treat people that have COVID or any of these other medical problems? Many times people will come in with symptoms that could just be a sinus infection, or it could just be a runny nose, or it could be a mild fever. And so we have to kind of, play investigator to figure out what's going on. But we have treatments. There's treatments for the both simplest problems all the way up to the more difficult ones. And it might just be hydration, IV hydration, IV vitamin infusions with all the immune boosters. It may just be decongestants that you need. It may be decongestants with antibiotics to help dry you out and treat a sinus infection. Or it could be something more, people who have developed some of the more severe problems associated with COVID have developed some respiratory problems. And these are the things that we want to treat early, whether it be oral prednisone, inhaled treatments, nebulizer treatments, more aggressive antibiotics, and ivermectin, things of this nature. And these are the things that we can do to treat you. We also have monoclonal antibodies, which are still showing to be effective in these coronaviruses that we have. So we can still use them. And those are the things that we want to use early on because they're very effective. We want to treat this virus with overwhelming force in the beginning, and we want to be very aggressive. And that's why we keep urging early treatment.